Forgotten indigenous tribes in the Amazon rainforest have finally been made aware of the global COVID pandemic more than 18 months after the world was plunged into lockdown. Mariano Quisto, a remote community leader deep in the dense forests of Peru, first learned of the global pandemic in October when health workers arrived by boat at his isolated village with vaccines. "We didn't know about COVID-19. This is the first we are hearing about it," Quisto said through a translator from the village of Mangal, in Paris' vast but sparsely populated Loreto region in the country's north. Government health workers and International Red Cross members arrived in Quisto Sur Arena indigenous community last month after a 3-day boat ride along rivers starting from the Amazonian city of Iquitos, the world's largest metropolis that is unreachable by road. In Mangal, the village highest up the river, residents hunt and fish for food and live in wooden stilt houses with no electricity, and many common ailments. Connection with the outside world is minimal and the local language developed in isolation over centuries. Brigades haven't come here in many years. These communities are really forgotten, said Gilberto Inuma, president of FIPIRCHA, an organization advocating for arena rights. The broader arena indigenous group, one of Paris' most insular, has just 5,800 people, official data show. But not all communities have been spared from the knowledge, or impact, of the pandemic, with at least 5 arena people having died from the virus. The trip upriver underscores the challenges of vaccinating remote indigenous communities in Peru and beyond, as well as gaps in wider healthcare access for remote groups. Many community members complained that what they really needed was better continuous healthcare services. In the village with no doctors, ailments include headaches, diarrhea, malaria and conjunctivitis, Quisto said. "We don't know how to take care of our patients. That's our worry." Indigenous communities, especially in the Amazon, have some of Peru's lowest vaccination rates, said Julio Mendiguer, who heads health policy for the groups at the country's health ministry. Less than 20% of them have been fully vaccinated, compared to around half for the country as a whole, he said. When you look at that number, you have to remember that to administer both doses, teams have to travel 4 to 5 hours. That's in the best case scenario, Mendiguer explained. Reaching Mangal required 26 hours of travel over 3 days along rivers that at times dry up or are blocked with fallen trees. The boat included a blue cooler box carrying 800 doses of China's Sinopharm vaccine, refrigerated with dry ice. A team will return in November to give second doses after administering over 600 inoculations. "I I decided to get the vaccine so that I don't get sick, said one Arena woman who was inoculated and asked not to be named because the community so infrequently speaks to outsiders. Because it's possible if traders come to visit they will bring the disease and pass it on.